In this video, we'll learn about drugs, some definitions, and the risks and effects of drug usage. We'll also be learning about its correlations to HIV, AIDS, and teenage pregnancy, some relevant Philippine laws and regulations, and also ways to promote drug-free lives and good reproductive health. Drugs are defined as any substance except food and water, which, when taken into the body, alters physical and or psychological bodily functions. They may be legal or illegal and have many different types. Common reasons a person may utilize a substance include recreational pastime, celebrations, boredom, social acceptance, rebellion, enhanced performance, or medicinal reasons. Drugs are categorized by the way they affect our bodies. They come in three groups. The first category, depressants, slow down the functions of the central nervous system or CNS and the messages between the brain and the body. No, they don't necessarily make you feel depressed. Small doses keep you relaxed and calm, but larger doses could cause sleepiness, vomiting, and nausea, and even death. Some examples are alcohol, minor tranquilizers such as Valium, and opioids such as heroin and morphine. Hallucinogens come in second. They affect and alter the five senses. Small doses can cause feelings of numbness, confusion, disorientation, or dizziness, while larger doses may cause hallucinations, memory loss, distress, anxiety, paranoia, and aggression. Some examples are ketamine, LSD, and psilocybin, or more commonly known as magic mushrooms. The last category, stimulants, speed up the functions of the CNS. Small doses may cause you to feel more awake, alert, confident, or energetic, while larger doses can cause anxiety, seizures, stomach cramps, and paranoia. Some examples are caffeine, cocaine, ecstasy, and nicotine. Despite these categories, however, some drugs could fall into more than one category. For example, cannabis counts for all three categories. Drugs are also sorted by how they are used. Analgesics or painkillers relieve symptoms of pain. Some are available over the counter such as paracetamol and ibuprofen, while others require prescriptions such as fentanyl and morphine. Inhalants are substances that are breathed in through the nose or mouth. They are absorbed into the bloodstream very quickly, giving users immediate highs. There are four main types. The first being volatile solvents like paint thinners and petrol, the second being aerosol sprays like spray paints, the third being gases like propane, butane, and helium, and lastly nitrites like room deodorizers and leather cleaners. Opioids like heroin and methadone are a type of painkiller that can be made from poppy plants or are produced synthetically. Also called narcotics, they are addictive as they can give you a feeling of well-being or euphoria. Party drugs like ecstasy are a group of stimulants and hallucinogens. They are often used in an attempt to enhance a party, festival, or concert experience. Performance and image-enhancing drugs are substances used by people to change their physical appearances or boost their sporting ability. Some help grow and repair muscles, while others stimulate the release of human growth hormones. Prescription drugs, also known as pharmaceuticals, are medicines prescribed by a doctor. These include painkillers and sleeping pills. Also, did you know? Drug-related deaths from prescribed drugs are more common than those for illegal drugs. Psychoactive drugs affect the way you think, feel, and behave. They act mainly on the CNS, changing brain functions and temporarily changing your consciousness. Examples include caffeine, cannabis, and LSD. Lastly, synthetic drugs are newly developed to create similar effects to banned drugs. These substances are being developed quickly, trying to stay ahead of the law, but are often illegal. Examples include synthetic cannabis and NBOM. RA 9165, Article 1, Section 3 lists examples of illegal drugs in the Philippines. This list includes cannabis, more commonly known as marijuana, MDMA or ecstasy, methamphetamine hydrochloride, commonly known as shabu, and opium or any other derivatives from opium poppy. Let's look into the risk and protective factors of drug usage. Risk factors contribute to increasing a person's chances of drug abuse, while protective factors contribute to reducing the risk for drug abuse. Some risk factors may be more powerful than others at certain stages in development, such as peer pressure during the teenage years, just as some protective factors, such as strong parent-child bond, can have a greater impact on reducing risk during the early years. On the personal level, risk factors include use at an early age, risk-taking behavior, experimentation, poor social skills and interaction, childhood problems, and feelings of isolation. Meanwhile, protective factors include self-controlling behavior, good reasoning skills, excellent social skills, positive interaction with people, and sense of belonging. Familiar risk factors include history and patterns of drug use, attitudes toward drug use, poor parenting and child rearing, inconsistent family rules, values, and ties. Meanwhile, protective factors include positive family relationships, clear and consistent family rules, strong family values, and reliance on family for emotional support. When it comes to peers and friends, risk factors include association with peers and friends known to use gateway drugs, such as cigarettes and alcohol, and the preference to stay with peers and friends than with family. Meanwhile, protective factors include association with peers and friends who do not use gateway drugs, formation of friendships, reliance on friends for emotional support, and inviting friends at home to know the family. In school, risk factors include poor academic performance, lack of commitment to studies, poor attendance in school, and involvement in fights and conflicts. Protective factors, on the other hand, include good to excellent academic performance, participation in extracurricular activities in school organizations, and showing interest in attending classes. In the community, risk factors include easy access to gateway drugs, poor community organization and neighborhood relationships, poor implementation of community laws, and many others. Meanwhile, protective factors include strong community relationships, active and positive community programs, projects and activities for the youth, and positive attitudes within the community. RA 9165, or the Comprehensive Dangerous Drugs Act of 2002, acknowledges that drugs are a multifaceted problem, particularly affecting the youth's physical and mental well-being. This requires multiple solutions, like controlling the supply and demand for illegal drugs by curbing internal production, distribution, and importation, studying the impact of illegal drugs and possible applications within the legal health system, and corrective measures for abusers, like treatment and rehabilitation towards reintegration as productive members of society. Let's look more into the effects of the unsafe use of drugs. In an individual, physical side effects include a weakened immune system, increasing the risk of illness and infection, cardiovascular conditions, and other multi-organ complications, brain damage, and to cognitive and psychological illnesses such as seizures, stroke problems, memory, attention, and decision-making, which make daily living more difficult, may also happen. These include but are not limited to paranoia, aggressiveness, hallucinations, impaired judgment, and more. In the family, effects include experiences of embarrassment, fear, hate and resentment, and anger upon learning about drug abuse. Financial instability is also an issue. Another effect would be the creation of harmful or even violent environments for children and spouses. Community effects include public health outcomes related to chronic and infectious diseases, public safety hazards such as crime, violence, and drug driving, large economic burdens, and deaths from overdose, effects on unborn children, and decreased workplace productivity. Now, let's talk about drug addiction and drug dependence. Drug dependence can be thought of as the first stage in drug addiction. It is possible for a person to be dependent on a substance without necessarily being addicted to it. Being dependent on drugs or alcohol means dealing with the physical dependence on the substance. This can happen with the chronic use of many drugs, including many prescription drugs, even if taken as instructed. Drug addiction can be seen in compulsive drug use despite harmful consequences, characterized by an inability to stop using a drug. Such issues include depression, anxiety, trauma, severe pain, sleep problems, and the like. When a drug addict stops using a drug, their body goes through a withdrawal, which is a group of physical and mental effects that range from mild to life-threatening. Given all this information, how can we correlate drugs with STDs, HIV, AIDS, and teen pregnancy? Let's first discuss some important concepts. The poor have the least opportunities to get by each day. A key element, it seems, to the use and distribution of drugs is always the desperation that the impoverished feel. Based on the final results of a 2013 survey in the Philippines, 1 in 10 young Filipino women aged 15 to 19 have become childbearing. This is more common among young adult women aged 15 to 24 with less education and higher among those classified as belonging to poor households than those in wealthier households. The problem has roots in both education and social class. The activity of protected sex is often discussed as a taboo topic, and the use of condoms is widely considered as a sin due to large influences like the church, rather than protected sex being viewed as prevention of the transmission of diseases. Meanwhile, as in relation to feelings of desperation when in poverty, young women often go into prostitution for money. Most of the time, they would engage in unprotected sexual activities to gain enough money for food and medicine. HIV and AIDS are diseases spread by blood or other bodily fluids. It primarily happens when people inject unclean needles during drug use and or when people under the influence of drugs have impaired judgment and engage in unprotected sex with an infected partner. The Philippine AIDS Prevention and Control Act of 1998, or RK 11166, recognizes HIV and AIDS as public health concerns that affect the social, political, and economic spheres of society. As such, steps need to be taken to ensure the well-being of non-infected persons, infected persons, and the nation as a whole. Protection of non-infected persons are done by raising public awareness regarding AIDS and HIV, and comprehensive discussions on its causes, modes of transmission, and means of prevention. Protection for infected persons are done by guaranteeing the same human rights and liberties as the non-infected. That is, compulsory testing is to be used only in specific circumstances. Drug use and addiction have been inseparably linked with HIV/AIDS since AIDS was first identified as a disease. Given all these, we could say that the correlation of drug use and HIV/AIDS is born out of the problem of poverty. The situation calls for solutions more than quality education or accessible healthcare. A citizen's desperation to live is what drives them into the hole of drug use and STDs. Overall, a drug-free lifestyle and good reproductive health do not only signal a healthy individual with a sound mind and body, but also signals a nation that puts the health of its citizens as a priority. As stated before, drug use and dependency in the Philippine context is heavily related to the poverty phenomenon that has always been prevalent in the country. As such, it is undeniable that to address the drug problem in the Philippines, one also has to address the root cause of poverty. While this holds true, it can also be said that having a drug-free life and good reproductive health is a choice taken by an individual, especially if they know the harms associated with them. The poverty cycle shows that the development of human capital and the building of a robust workforce is necessary to improve the lives of people. Hence, to prevent the rise of drug abuse, the spread of diseases such as HIV/AIDS, and the increase in teen pregnancy, it is important to have affordable access to education for the youth, and most especially to have access to employment opportunities with health benefits. Strengthening the reproductive health mechanism in the Philippines is also of much importance. Accessibility to family planning methods and contraceptives must be increased, and services related to family planning and reproductive counseling should also be increased. Additionally, the removal of the parental consent imposed on minors to be able to purchase or gain access to contraceptives and family planning services should be sought after. Additionally, while it is necessary to view drug use and addiction as a criminal problem, much more attention needs to be given to the fact that drug addiction should be viewed more as a medical problem. With this lens, the psychological aspect of drug dependence can be highlighted, and more individuals may now get proper treatment and rehabilitation. Lastly, not giving in to peer pressure as a lifestyle choice empowers one to make their own judgment without prejudice and misinformation. It is also important to surround oneself with peers who advocate for a healthy lifestyle and a sound well-being. That's all for this video. Thanks for watching.